This conference will now be recorded.
Thank you, Laura. As Laura said, my name is Anna Vanskoik. I am a librarian at the Hopewell branch. And before we get started tonight, I do want to share a few programs that are coming up. They're on November 7th, Monday. We are for Alzheimer's Awareness Month. We are having the 10 warning signs of Alzheimer's, which is taking place again on Monday, November 7th. And that's going to be presented by Robin Cohen, who is the Director of Programs and Services for the Alzheimer's Association of the Greater New Jersey chapter. And I've put a link in the chat box so you can also see where the chat box is for something to you to look at after the program today. And again, celebrating in November is Native American Heritage Month, and we are hosting a program on Wednesday, November 9th at 7 p.m., Archaeology and the Delaware Indians. And this heavily illustrated presentation will examine New Jersey's rich Native American heritage, and it's going to be presented by a fan favorite presenter, Dr. Richard Veit, who is the professor of anthropology from Monmouth University. And I'm going to put a link to that registration as well in the chat. And I always like to emphasize that along with these virtual offerings, we have many programs that are being presented in our branches. And I invite you to take a look at our online calendar to see what is taking place in the branches. We have 9 branches as well as upcoming virtual programs. So those are all for things you to peruse after today's program. So let's talk about today's program. It's open enrollment time, and this afternoon's program is our medication information session, which is going to be presented by Kelly Ott. Kelly has been a Mercer County SHIP coordinator since March 2022. Previously, she worked as acting SHIP coordinator in Burlington County. Over the years, she's worked in multiple not-for-profits and managed volunteer programs throughout South Jersey. She is a graduate of Stockton University and a lifetime resident of Camden County. Kelly, I'm going to pass it off to you, and thank you so much for sharing your information today.
Thank you, Anna. Thank you, Laura. I'm here today to talk about some Medicare changes for the upcoming year, which I'm sure everyone's excited about. So what we have today is what's new with Medicare in 2023. Some things may apply to you, some things may not. We would also like to remind you at the end, I will provide some contact information. I'm coming from the State Health Insurance Assistance Program. Most of you may be familiar with SHIP. We offer Medicare eligible individuals assistance with anything related to Medicare. So we'll go over that as well. But I just wanted to let you know that we do have resources available and certified trained counselors that can assist you because I know this process can be pretty overwhelming for most. So this year, the Social Security cost of living adjustment. The cost of living adjustment for 2023 will be 8.7% increase in benefits. So the average retirement benefit amount will increase $140 per month, which is the largest cost of living increase in over 40 years. Just to review the basics, Medicare has 4 parts, which I'm sure most of you are familiar with. A, B, C, and D. The Medicare prescription drug coverage of Part D is what is most popular this time of year during open enrollment. Each Medicare has different rules for enrollment, monthly premiums, deductibles, as well as cost sharing for services, and that is your coinsurance and your copays. The 2023 Part B costs this year are $164.90. That does go down from last year. The annual deductible would be $226. Coinsurance will be 20% for most Part B service. And there is an excess charge, additional 15% coinsurance for providers who do not accept Medicare. This is allowed amount as payment in full, depending on assignment. If you have Medicare supplement policy, which is called Medigap, or have retiree health benefits from a former employer, this usually covers some or all of the Medicare Part A and Part B cost sharing. This year, if you look at your income, that determines the pay amount, the premium you pay per month for Part B in 2023. So as you can see, for the most part, $164.90 is the most common. I do have access to all this information as well as our counselors if anyone has any questions regarding what they might be expected to pay as their premium. This is part of the income-related monthly adjustment amount. COVID is a very hot topic, continues to be. The COVID-19 vaccines for people with Medicare as well as COVID boosters, you do not pay anything for the vaccine. You are able to get it at pharmacies, clinics, doctor's office, hospitals, and you are even able to get it at home depending on how it's administered and by who. When you do get your COVID vaccine, we ask that you bring your red, white, and blue Medicare card to your appointment. And even if you have a Medicare Advantage plan, the red, white, and blue Medicare card is needed. You can also find out if you need a booster, if you are age 65 and older, or have additional health risks. It's essential to get a booster. It's definitely recommended. Covered under Part B as clinical laboratory tests is your COVID testing. There is no cost sharing and applies to original Medicare and Medicare Advantage plans. The first test is covered without a prescription. Subsequent testing requires a prescription. So what we discussed in our latest training of all of our counselors, a lot of places are asking if you are traveling, attending a wedding, they may ask for a negative COVID test. Most will not be covered if you went to your doctor to say, I need it for that purpose. You need to be exhibiting symptoms in order to get that COVID test. Medicare covers COVID antibody tests and antibody treatments. So this is just some information that is helpful. Medicare will also cover at-home rapid COVID tests, purchased over the counter and at local pharmacies. All of your COVID treatment is covered by Medicare A and B or your Medicare Advantage plans. Annual enrollment for people with Medicare. So we've already been full swing into open enrollment. That is from October 15th to December 7th. You are able to, at this time, join or switch a Medicare prescription drug plan. Join or switch a Medicare Advantage plan. This is your time to shop around, compare your health and drug plan choices. Because of changes in plans, changes in coverage, this is your best opportunity to see if the plan that you're currently on is the one that's best for you. You need to choose the plan that fits your needs, and the coverage for these changes will begin on January 1st, 2023. You will have your membership card and materials in hand, as well as the coverage. These enrollment or changes to Medicare supplement policies like Medigaps can be submitted anytime for those age 65 and over, and is not restricted to fall enrollment period. It is very essential this year, looking at different drug plans and changes. Right now, there are 24 drug plans available for 2023 in New Jersey. Cigna Essential RX plan is ending. Members are being moved to Cigna Extra RX plan. Members will see a premium increase from $34.90 to $73.50. This again is why it's essential that you look at the plan you have and see what type of coverage best fits, because that's a large increase for most. Other plans with significant premium increases for this year include Horizon Medical Blue Saver plan. That has gone from $28.50 to $59.50. Humana Walmart Value Plan from $22.70 to $34. Mutual of Omaha Premier Plan from $37.10 to $65.70. The lowest Premiums for this year include SilverScript Smart Saver RX, which is $6.80, WellCare Value Script at $9.30, and Cigna Saver RX at $13.80. I'll leave this up for just a second. If you are someone who has any of these plans or any plan in general and would like to have a plan comparison by one of our counselors, you can do so. Again, I'll put our contact information up at the end, but some of these increases are substantial and can make an impact for sure on an individual's income on a monthly basis. I do have a New Jersey Part D plan chart, which I will offer to Anna and the library with our slides that you can check, but they sometimes do change from time to time. So again, the counselors have the most updated information. Most plans with a deductible exclude the deductible for some tiers. You may pay a copay for some drugs, and the plan pays the rest. 5 of these plans have additional coverage in the gap. Members will pay less than 25% for some drugs. 9 plans have insulin savings. New this year, you pay $35 or less for certain insulins for most of the year. There's no deductible and no coverage gap. I will go into the insulin changes a little bit later in the presentation. So this is the insulin new for 2023. There's a $35 cap on insulin copay. This is huge for most diabetics. Starting January 1st, 2023, insulin will be covered by Medicare plans. They cannot have a copay higher than $35 a month. There's no deductible. There's no coverage gap. All Medicare drug and health plans can choose which insulins to cover on their drug list. You need to enroll in a plan that has your insulin covered. You need to use your plan's in-network local pharmacy or mail order in order to take advantage of this $35 cap. The $35 insulin copays will not show on Medicare.gov. The Inflation Reduction Act passed too late to be reflected on Medicare.gov Plan Finder. You will have to do the plan comparison without insulins on your drug list. In order to do this, you may need the help of one of our counselors if you have any questions navigating it. If not, you're welcome to use the Medicare.gov Plan Finder on your own. It's a great resource to compare all of your plans and see which works best for you. In order to do this on your own, you need to capture the top 3 plans with best costs and coverage for non-insulin medications. You can run a second plan comparison only for the insulin to find which has the best coverage and possibly the best cost. Then you're able to see if any plans in insulin comparison match plans in the first run of best plans for non-insulin meds. Part B of insulin cost sharing. This starts on July 1st. So the first $35 cap starts January 1st. This has to do with injectables for July 1st. With the DME pump. This is insulin used with the DME pump. So if you use this, your cost sharing does not take effect until July 1st. This is also capped at $35 per month cost share and no deductible. Currently, this is covered with 20% cost share after the B deductible has been met. Cap is only for those in original Medicare, not Medicare Advantage plans. So that's important to remember when you're deciding on which plans to pursue. I'm sure there'll be some questions about the insulin coverage if it applies to you. Again, we'll be happy to answer those questions at the end. Again, this is new starting for this year. There's a lot of positive changes. There's a zero cost for Medicare covered vaccines. Part D covered adult vaccines recommended by the Advisory Committee of Immunization Practices will be covered by Medicare Part D at 100%. This includes vaccines for shingles, tetanus, whooping cough. All Medicare drug and health plans must cover these vaccines on their plan formulary. So this is great news that you don't have to worry about. This is zero cost for any of these Medicare covered vaccines. Due to the Inflation Reduction Act, there is an implementation timeline of prescription drug provisions. So this is kind of the timeline from this coming year, 2023 through 2029. I'm going to leave this up for a second. Basically, these are things that are going to be done, and overall, it's going to limit Medicare Part D premium growth to no more than 6% per year. In 2023, it starts by limiting the insulin copay to $35 per month in Part D. It reduces costs and improves coverage for adult vaccines. In 2024, we will be able to know that the Medicare will be eliminating 5% co-insurance for Part D catastrophic coverage. Followed by 2025, it adds $2,000 out-of-pocket cap in Part D and other drug benefit changes. And then 2026 through 2029, it implements negotiated prices for certain high-cost drugs. So over the course of those 4 years, there'll be 10 Medicare Part D drugs that are negotiated, 15 in 2027, 15 in 2028 for Part B and Part D drugs, and then 20 in 2029 for Medicare Part B and Part D drugs. So this is gives you a little idea of the changes that should be implemented over the next several years that hopefully will impact your ability to continue to live independently and be able to afford the high cost that is associated with living in New Jersey. Okay, let's see. Let's move on. Oh, sorry, give me 1 second. Okay. So the best way to compare plans. So first there's coverage. You need to ask yourself these questions. They're essential to determine what plan would best fit you, your health and prescription. So are my drugs covered by the plan? This is the most basic question. Are there any restriction? Is there prior authorization? These are all important things to be aware of in order to determine which plan best suits you. Additionally, cost. You got to look at the premium, the copays, deductibles. You got to compare your total yearly drug and the premium cost. It might have a low premium cost, but over the course of the year, you may be paying way more than you need to on certain plans. You have to remember not to include the cost of insulin, as we discussed, or vaccine based on the prices shown in Plan Finder. That is just something that couldn't be avoided with Medicare.gov since the changes were instituted after the Plan Finder was developed in August. Convenience. Is my pharmacy in the plan's network? Do they offer mail order? Has a preferred pharmacy with lower copays? It's great if you find a great coverage, great cost, but then if it's inconvenient for you to get the medicine that you need on a daily basis, that's a problem. So these are all things to consider when choosing your plan. Another thing to consider is coordination. Will it work with my other health or drug benefits? There are some programs like our PAD program where certain plans may not work with certain drug coverage and things like this. So if you have other programs that you're a part of, your different coverage, you just want to make sure that it will all work together with your other plan and drug benefits. All right, so if you haven't already, this is a great resource, is to create your Medicare account. That is on www.medicare.gov. After you are able to create this account, you'll be able to see all of your Medicare claims, your Part A, your Part B. If you've already uploaded, you would have your list of your medications already there for your Part D plan. This is great to have this already completed. It's so helpful. If you need some information, we do have this resource on YouTube that we've been provided by the New Jersey Division of Aging Services and the Department of Human Services. They've gave us some information from Medicare.gov, and this YouTube here, again, is a great resource. So what happens if you have a prescription that is not covered by the plan you choose? This happens more often than you think. Once open enrollment is over, you're locked into your plan for the year. Open enrollment doesn't come around again until next October. If this occurs and now you're on a different prescription, you and your doctor should work with the plan. And by that, you could switch to a similar drug that is in their formulary. If you cannot switch drugs, your doctor can request an exception to have it covered. If plan denies your exception, you can request you can appeal. You can also change to a plan that covers your drug during the next annual open enrollment or special enrollment period. I've had several people who have needed exceptions or appeals, and we have had our counselors assist with that. That's another way that the SHIP counselors here in Mercer County can assist you with appeals and just helping you with those exemptions because these things do come up. As many of our clients and beneficiaries have said, they've been getting a ton of calls, mailings, seeing tons of advertising for different Medicare programs that are not affiliated with Medicare.gov. That's not what is ideal. There's TV ads offering extra benefits in Medicare. These plans, they're saying they have all this coverage. It's always best to get an unbiased opinion. So if you do, think one of these programs being advertised as something you're interested in, it's great to get information, but then follow it up with a call to SHIP so that you can see like what it's legit. But most of these Medicare coverage helplines and things like that is just basically an ad that will link you to insurance selling strictly Medicare Advantage plans. So what is Medicare Advantage? A lot of people are unaware of what Medicare Advantage provides you. These are structured as HMOs and PPOs. Insurance companies contract with Medicare to provide your benefits. You must get all medical services and drugs through this plan. As part of this Medicare Advantage plan, you may have to use specific doctors, hospitals, and labs. You may need referrals for services and specialists. You may get extra benefits not covered by original Medicare. These benefits include eyeglasses, hearing aids, dental services, gym discounts. It is not supplements to Medicare. No claims go to Medicare. All are processed by this plan. Plans are offered differently by county. So your friend could live in Camden County or Sussex County, and they may have a plan, a Medicare Advantage plan that's not available in Mercer County. So we run into that a lot as well, where people, they hear about something their friend or relative has in a different area, and it's just simply not offered in Mercer County. So again, we're happy to fact check for anyone looking to get Medicare Advantage plans and what the coverage actually is. Premiums for Medicare Advantage usually range from $0 to $120 per month. Many plans do have a $0 premium. Some plans also offer a reduction in members' Part B premium. If a plan has a premium that's close to $100, it's better to look at a different Medicare plan or consider a Medigap policy. Some plans have deductible before plan will pay. Plans charge you a copay every time you use a service. This is until you reach your maximum out of pocket, which typically is around $7,000 to $10,000. And then at that point, the plan will cover 100%. Here's a sample of some of the supplemental or extra benefits offered by some Medicare Advantage plans. Again, each plan is different, so you want to look at the individual plan. Some of the benefits include dental benefits. Some only are routine and preventative. Some others cover comprehensive up to a certain dollar amount. Others offer home delivered meals after a hospital stay. I mean, that's an interesting perk. Others have $100 to $400 spending card to be used to purchase over-the-counter health-related items such as adult diapers, shower chairs, cold medicine, things of that nature. Some offer transportation to medical appointments. Others have worldwide coverage for medical emergencies. There's also a travel benefit, which it means you're able to use providers in other states. Each plan summary of benefits would have the details on what their supplemental or extra benefits are exactly. This is also a very important bit of information. If your plan is not renewing this year in your county, plans that end December 31st, 2022, you likely would have been notified already, but if you have not, these are the plans that will be ending. All Horizon Medicare Blue Advantage HMO and PPO plans ending. This impacts 76,000 members in New Jersey. Aetna Medicare Explorer Elite HMO. This is ending not in our county, but in the surrounding counties. Cigna Preferred Plus Medicare HMO is ending in all counties. WellCare, no premium open PPO and WellCare Give Back open PPO HMO is terminating in all counties. All above members need to take action to enroll in another plan. This is important information. We are already receiving calls. It seems as though the notices for these plans ending have been sent out about October 15th. I know in Mercer County alone, there's about 700 beneficiaries that are being impacted, that are not all of them will call for assistance, obviously, but a lot of them have started to call looking for some advice on what to do now that their plan is ending. So again, this is another way that SHIP can help if you or someone you know has a plan that's ending and is confused about what to do. If your plan is ending, if you take no action, you will be enrolled in the traditional Medicare A and B, but have no drug coverage on January 1st. Because their plan's ending, you do have an extended open enrollment until February 28th, 2023 to enroll in another Part D or Medicare Advantage plan. If Medicare Advantage plan is ending, you can return to original Medicare and have guaranteed issue until March 2nd, 2023 to purchase a Medigap policy and not be turned down. These dates are very important. We see too many people that don't respond in the appropriate amount of time and are left, without coverage or scrambling to get the coverage they need. I would not wait until late January, February to make these changes, especially if you need some assistance in your choices, because we will see an influx of calls come February where people are looking for assistance to get these things taken care of. So the sooner the better. So, this is important changes. It's about your health, your coverage, your drug coverage, and when these changes occur, it's great to have the extra time, but sooner is always better. Here are just some questions to ask before enrolling in a Medicare Advantage plan. Are my doctors and hospitals in the network? We do have a list of a lot of the plans that work with a lot of the Mercer County hospital systems. So we have some of that for reference if anyone needs that. What are copays and coinsurance for each service? Doctor visits, outpatient procedures, specialists, physical therapy, medical tests, hospital stays, medical equipment, all these things, these copays can add up rather quickly. So it is important to get this information ahead of time. It's important to know, and these are simple questions about your out-of-network coverage and costs. Are referrals required? Are my drugs covered? You cannot enroll in a separate Medicare Part D plan when enrolled in a Medicare Advantage plan. This is important to know, just because these things do not go hand in hand. This is their own package for the Medicare Advantage. Will enrolling in the Medicare Advantage plan affect my employer or union coverage? This is something to definitely speak to your employer or your union about as well, because you don't want to, have that affect your coverage that you already have existing and possibly for less money through an employer or union. Always great. We all need it. Details on eyeglasses and dental coverage. That is usually one of the perks that Medicare Advantage plans offer, is coverage for certain things, but we need to know what the coverage is for those eyeglasses and dental. And the other thing to consider is if you travel out of state, what is your coverage? What will you be responsible for? Again, these are all questions that are essential when choosing a Medicare Advantage plan. So now that you've seen a lot of this information, you know what options are, what you need to compare. The next question would be how to actually join a new plan. So with enrolling in a Medicare Health or prescription drug plan, you're able to do that through the Medicare.gov website. You can call Medicare. You can call your actual plan. You can call the plan that you're interested in. If you're interested in Humana, if you're interested in Cigna, you can call them directly to do your enrollment. Enrolling in a new plan will disenroll you from your previous drug or health plan. If you have other coverage, like from an employer or union, you should check with your plan's benefit administrator before making any changes to your coverage. This is very important. But if you are not and you're just looking to join a new plan, you're welcome to do so again by enrolling on the Medicare website, calling Medicare, or calling the plan provider. If you need help with doing this, if you need some guidance on which plan, if you're not sure, again, SHIP counselors are here and available to help you with that. So the Medicare Advantage open enrollment period. What if you don't like your Medicare Advantage plan? From January 1st to March 31st, you can switch Medicare Advantage plans, or you can leave Medicare Advantage and return to original Medicare with a Part D drug plan. Important to note, if returning to original Medicare, you can apply for Medicare Supplement Policy, which is Medigap's, but you are not guaranteed to be issued a policy unless you qualify for a Medicare Advantage special trial. So if you come upon a need or reason that you don't like your Medicare Advantage plan, you want to switch, you want to return, any of these circumstances are available to do January 1st through March 31st. And if you need assistance with this, again, this is something that SHIP counselors can assist with. Medicare Advantage offers no risk trial situations. If you cancel a Medicare supplement policy December 31st, 2022, to enroll in a 2023 Medicare Advantage plan for the first time, again, for the first time, or you have a 1-year trial and any time during 2023, you can disenroll from a Medicare Advantage plan and return to original Medicare. You can enroll in a Part D drug plan. You can purchase a Medicare supplement policy and not be turned down. You can get back the Medigap policy you had in 2022. If that plan no longer is being sold, you can purchase certain Medigaps from any company. So this is something that is important to consider as well. If you stay with original Medicare and want a Medigap policy, policies are sold by insurance companies. They cover cost sharing in original Medicare plans, Part A and B deductibles, copays, and coinsurance, also called Medicare supplement insurance. There are 10 standardized policies available, Plan A through N. The plans of the same letter have the same coverage. Only premium costs are different. You can go to any doctor, hospital, or provider that accepts Medicare in any state. This is how your Medigap policies work. Again, I'm reviewing this just as this is the time of year just to be aware of these programs and the different policies and things that are available to you. And that way you can make a very educated decision on how you want to proceed with your coverage, since it's once a year that these things occur. This is how your Medigap policies work. You pay a monthly premium for your Medigap in addition to your Medicare Part B premium. Typically, it's $100 to $300 per month based on your plan and age. Medigap pays claim after Medicare pays. Only covers Medicare services. Companies are able to turn you down for coverage after your first 6 months with Part B. This does not cover your prescription drugs, and you need a separate Medicare Part D prescription drug plan. Premiums increase with age, increase with time, any time of year with state approval. You can keep a policy if you move anywhere in the U.S. You are able to get information, again, for Medigap by calling 1-800-MEDICARE. They have free publications. You can call companies that sell Medigaps for a premium quote. Also, you can call the New Jersey ship as well as your local ship in Mercer County. If you're age 65 and over, you can apply at any time, and it's not limited to your Medicare enrollment period. Most of you, if you are already on Medicare, this is just something you probably have already reviewed. But should I choose original Medicare or Medicare Advantage plans? You stay with your original Medicare if you have health coverage from a former employer or union and want to keep it. You are, as they say, a snowbird or travel long periods outside of New Jersey, or you want the freedom to go to any Medicare doctor in the U.S. Programs to help with Medicare cost. So here at the Children's Home Society of New Jersey, we host 3 different programs currently. We have grants for all 3 programs. It's the Benefit Enrollment Center, MIPA, and SHIP. They all work hand in hand, and some of the programs that our SHIP counselors do not assist with, our MIPA program and Benefits Enrollment Center do assist Medicare eligible clients with these programs. So this is a great benefit, a great resource. Perhaps it doesn't apply to you, but maybe it applies to a loved one. So these are 4 programs that help with Medicare cost. Medicaid, Medicare Savings Program, which is our MIPA, New Jersey PAD, New Jersey Senior Gold Drug Discount. The New Jersey Family Care Medicaid Program, it's who is eligible. These are 2022 rates, which are what we're going by. It's a monthly income less than $1,133 single, $1,526 married, and goes into assets, single or married. Medicaid pays all of your Medicare costs, all Part A and B items, premiums, deductibles, coinsurance, for hospital doctor's tests, lowers prescription copay to $1.45 or $4.30. Medicare pays first, Medicaid HMO pays second. You are able to apply at the County Board of Social Services. We at the Children's Home Society of New Jersey, our benefits enrollment coordinator, can also assist in your application process with this as well. Help paying Part B premiums with our Medicare Savings Program. This is a large amount of our calls we receive from SHIP as well that get referred to our low-income programs of MIPA and Benefits Enrollment Center. This is a great resource. If you're eligible, please take advantage of it. This is specified low-income Medicare beneficiary. It's called Slim B and qualified individual. Who is eligible in 2022? Monthly income less than $1,529 or $2,060 if married. Resources less than $8,400 single, $12,600 if married. If you qualify for Slim B or QI, you will net additional $165 a month in your Social Security check. This again is something you can apply through the state. We actually have through our programs here a One New Jersey Save application, which allows us to screen and process applications for 5 different programs, Slim B being one of them. Another program that a lot of people qualify for but don't always take advantage of is the New Jersey Pharmaceutical Assistance to the Aged and Disabled program. That is called PAD. The 2022 income limits, it was increased quite a bit from last year to this year, is $38,769 a year. For married, $45,270 a year. PAD helps members to pay no more than $5 for generic drugs and $7 for brand name drugs. PAD pays the premium for your Part D plan. There's no Part D deductible, copay, or donut hole. This is, again, something you can apply through the state, or we can screen you and put you into the New Jersey Save application. And again, it's like one-stop shopping for all the programs to see if you're screened and eligible. Senior Gold, this is also a prescription discount that we are able to screen you for. This income eligibility is higher than PAD. As you can see, it's about $48,000 single and $55,000 married. You pay $15 plus 50% of the remaining cost for each drug. You must be enrolled in a Part D drug plan. Senior Gold does not pay the Part D premium. So this is just another program that helps, just supplement the cost that you would pay for your prescriptions. Doesn't cover quite as much as PAD, but it's still a great program and a great resource if you qualify for it and are eligible. This is the application that we have spoken about, New Jersey Save. We are able to, over the phone or in person, assist applicants to apply. Typically, we do applications online. The reason for that is they are completed in a much quicker way and processed if done online rather than a paper application. So when we help our beneficiaries apply, it's one application for PAD, Senior Gold, federal extra help with prescription costs, help with Medicare Part B premium costs, Slim B, help with heating bills, that's utility assistance, also helps with cost of hearing aids. Here at the Children's Home Society, we also can screen for SNAP, which is what used to be referred to as food stamps, food assistance. So all those programs we're able to assist with, as well as your normal needs for Medicare. So to review, I know it's a ton of information, and I will supply Mercer County Library System with these slides as well. So if you would like to look over any of this, it will be made available to you. But changes this fall that can be made: Medicare open enrollment, October 15th till December 7th. All the changes that are made then take effect January 1st. This is your time to review and compare plans. We have counselors available to help you with that via phone, in person, or Zoom. If you are already in a Medicare Advantage plan, you can also make changes January 1st through March 31st. If you are happy with your current plan and it's still offered in 2023, you don't need to do anything, but you do want to review changes because there are some cost increases, especially with the drug plans, that you want to be sure to realize how costly some of them have increased in such a short time. Always a public service announcement about scams. Medicare will not call you and ask you for your bank information or social security number. You need to protect your Medicare number, same as you would your credit card. Medicare will not send representatives to your home. If someone comes to your home, they are insurance agents trying to sell you healthcare policies. I will say that if you do apply or have any interest in applying for the New Jersey Save applications, one of our staff members that calls you will go over information that will include your bank information, information about your income for the year, and additional information. Again, that would be once you initiate a call to be screened for the New Jersey Save application. These things are just essential for the application. But that, again, would be a Children's Home Society staff member that would be contacting you at your request. This is a way you are able to get charts for Medicare plans in New Jersey. We have the www.agingnewjersey.gov. Click on the Medicare options link. These are great resources. Anything on Aging New Jersey Gov. There's so much information about all the programs that are offered for older adults in New Jersey. You can also find some help with the Medicare Plan Finder. I know I mentioned that previously, but the Plan Finder will help you step by step go through and compare plans. If you know what you want, you already have decided you want to change, you've looked into it, you can just contact the plan directly. You don't need to do anything else. You're also welcome to call Medicare. They are very helpful as well. And lastly, the New Jersey State SHIP program. You have that available to you, as well as the Mercer County SHIP. And I'll give that number at the end. Here is the contact information. This is my work cell phone number, 609-273-0588. This number is the best way to contact a staff member of SHIP. Through this voicemail box, we will refer any calls to our Benefits Enrollment Center and our MIPA staff, and they will be able to screen beneficiaries for your eligibility for other programs and services. With that being said, this is all I have for 2023. It is a lot of changes, a lot of information, but I'm welcome any questions.
Kelly, thank you so much. It is a lot of information, and I do want to emphasize that the numbers that you gave to give help, that I know that that's very helpful for people, especially when they start to go through it. And even though you talked about they may have additional information that they may not have thought about during this presentation today, I do have a couple questions if you have some time to field those. Okay. So one participant asked that says that they'll be joining Medicare in March of 2023. can they still set up a Medicare account now? And can they input their current prescription drugs now?
I would recommend waiting until about 2 months, 2 to 3 months prior to your month that you will turn 65. They do not want you to uh, be too far in advance, even though the most of the information will still be appropriate. You can do your research, but genuinely, the 2 month mark is pretty much your safest bet to just go ahead and do it then. 2 months before is most common recommendation that we like to offer.
Okay, and then there was another question. Roughly, what percentage of people in Medicare go for Medigap versus Medicare Advantage? Do you have like an estimate for that?
I actually don't. And I've heard good and bad like experience. It just depends on the individual. I do not have that exact number. I could look it up if you'd like. I'm sure you could Google it, but I don't have that exact stat. And it does change because there's a lot of circumstances where um, people may change from one year to the next. But that's not something that I have available. I'm sorry.
And then I have an attendee who's saying that they're turning 65 in May 2023. You might have touched on this already, but I'm going to go and go through it.
Mhm.
They will not be starting Social Security till they're 67. They're covered under their wife's private employer. Then they're providing insurance for those 2 years. It's their understanding they're required to register for Part A at the age of 65. Is that correct?
So at the age of 65, you should, without a doubt, register for Medicare A, even if you have other coverage. If you have any questions, please call a counselor. There are fees and penalties if you do not. However, if you are covered by and you have proof of insurance, then you would not incur those fees if you waited. So my best recommendation would be about 2 months before. Give your SHIP counselor a call. Again, they are trained, certified, and unbiased, and let them know all your circumstances because there are a variety of circumstances. Sometimes we've seen at age 65 when like people's spouses get dropped from their insurance. There's things that occur. So it's just best that you go through and speak with someone who's very knowledgeable about that because circumstances change and there's little things that you might think aren't important that are. So it would be best that again 2 months prior check in with one of our SHIP counselors. They can walk you through the process and help you get set up with your Medicare A. And again, you're not getting your Social Security yet, so there's no cost involved, anything like that. But it is best that you speak with someone because situations change. We have people that their employer said, oh, 65, okay, we're going to drop you from your insurance, things like that. So yeah, just reach out about 2 months prior.
And there's a second part to this question. You might give the same advice about this because they're planning to register for Part B at 67 when their wife will retire and no longer be covered by private insurance. Are there any penalties for waiting to register for Part B?
So as long as you have coverage, you're fine, and you can have proof of insurance. We had an incident where a person worked different jobs. Their employer was bought out. She couldn't find her. It was a whole lot of trouble to get the information she needed to prove that she had health insurance for the 7 years that she did not have and was eligible for Part B. So having proof of insurance is definitely essential. And again, I would just recommend a quick phone session or Zoom or in-person session with a SHIP counselor because there's different things for, state employees that are retired, railroad retirees, and it's just helpful to get that information.
Thank you so much, Kelly. And then there's someone who's here who's retired and covered by the County of Burlington. they live in Mercer County now. Should they call Mercer or Burlington County SHIP? Also, do they get an NJ state pension?
I Again, that's an individual case. I would recommend if you
Yeah.
reside in Mercer County, you would call Mercer County, and if they're unfamiliar, they would then check in with Burlington County. But if you, it's where you reside, not necessarily where you work.
And I don't see any other questions coming in. But again, I do want to reiterate that Kelly has offered to send the PowerPoint that she shared today, so you can have that as a resource as well. So I will get that out to everybody in the who registered today. And again, Kelly, thank you so much. I know it's so much information, and everyone hearing it, I just hearing it as much as they can. So I appreciate you taking the time to outline the procedure with everybody. I do want to thank Laura for helping everything go smoothly behind the scenes. And I hope to see everyone here at future events. And again, Kelly, thank you so much. And everybody have a
Thank you
great
so
day
much.
now.
Thank you
Thank you,
for having
Kelly.
me. A
I'll be in
pleasure.
touch with
Thank you.
you. Thank you.
Bye.